If your child has been diagnosed with ADHD, a sleep specialist may be one of your next steps.
Yeah, some research suggests a link between the behavioral disorder and sleep apnea.
So we invited Dr. Gary Swanson, a psychiatrist with AHN, to join us with some helpful advice for parents and really just to kind of educate us a little bit more about this. Thanks so much for being here.
Glad to be here. Thanks for inviting me.
So can we talk about these two and why there is some connection between them?
Well, when you don't get a good night's sleep, all of us know that we are not at our best. We can be irritable, we can be tired, and we can have a hard time paying attention.
Yeah.
Parents sometimes will notice those symptoms in their kids, that they're irritable, that they're hyperactive, that they're not paying attention, and they may bring that concern up to their pediatrician. Pediatricians should look at that and consider the diagnosis of ADHD. But sleep apnea is another possibility, and it's important for the pediatrician to check and see what the child's sleep patterns are like.
Oh, I see.
Well, I know some people were curious if sleep apnea can cause ADHD.
Well, we think of ADHD as a separate problem, but the symptoms overlap.
Okay.
And some kids have both sleep apnea and ADHD, but if you recognize that there's sleep apnea in a child, you can treat that, and then the symptoms of ADHD may be gone, and that leads to avoiding a diagnosis of ADHD.
I'm so curious about sleep apnea too, because you know, you hear about this happening with people who are adults, maybe overweight, but for a child to have sleep apnea, it's not even something that I would have considered.
Yeah.
Well, it's pretty common actually. 1 to 4% of kids will have sleep apnea.
Wow.
It's most often linked to large tonsils and adenoids in kids between the ages of 2 to 8. Their airways don't tend to be growing as fast as their tonsils and adenoids do. So the tonsils and adenoids block the airway and make it hard to breathe.
And is that why a pediatric dentist may actually notice that there could be something going on?
Pediatric dentists might notice that, a pediatrician may notice that, and again, it's important to ask about sleep. There's a particular facies. Some kids look like they're adenoidal, and that may give us a clue that they're a mouth breather and that they're having a hard time breathing at night. Certain other problems, Down syndrome, there's certain craniofacial abnormalities that are also connected with it. And being overweight as a child can also contribute to it.
I see. Okay.
Well, if you're a parent and you're already seeing kind of symptoms, I mean, how do you know when to go to the doctor to even consider if it's ADHD? Like, what is the typical age that kids can be diagnosed?
Kids are usually recognized somewhere between the ages of 5 and 12 for ADHD symptoms. And what you'll see is they're having a hard time focusing and paying attention, they're having a hard time with hyperactivity, and it starts to interfere with their school performance or social performance. And parents will oftentimes bring that up with their pediatrician. Sometimes they don't. Sometimes there's still a stigma about that sort of thing.
Of course.
And sometimes kids are misdiagnosed with something else. Hey, you're just not working hard, or you're not listening. Those are possible, but less likely. There's also other comorbid problems that can cause academic issues, learning issues, reading issues, things like that.
So is it possible, I mean, are there kids out there who have been misdiagnosed with ADHD and could just have, I mean, not just, but have sleep apnea?
So it's certainly possible.
Yeah.
And I know when I evaluate kids, one of the things I'm asking about is how they sleep. And I think a pediatrician, when they're doing their evaluation of a kid with ADHD symptoms, should ask about their sleep. It should be part of their normal screening. And if they have some of the risk factors, they may want to look further into that. Really, the only way to diagnose sleep apnea in a child is with a sleep study. There are some things that sort of give you a hint, but the only really good way to look at it is that. There are other things that look like sleep apnea. Sometimes kids get infections, have allergic reactions to environmental allergens, and they look like they're having a hard time breathing, and that can happen for a short period and get better.
And get better after that.
Well, I think it's one of those things that parents should really consider all the options instead of just assuming, oh, like you said, like, oh, they're just acting up in class or...
Right. There's a lot, and everybody sort of jumps to conclusions, oh, they're having this problem for this reason or that reason, and a good evaluation can help you to sort that out.
It's really interesting stuff, and I had not heard any of this before, so finding out more is really great.
I've seen a few kids over the years who came presenting with ADHD symptoms, and then when I evaluate them, it's I don't normally look in kids' mouths, but I'll look, oh, those are pretty big tonsils. We maybe need to look at that.
Wow, that's so fascinating.
Really great. Thank you so much for joining us today.
Thanks for having me.
Yeah, it's really great stuff.
Well, if you're interested in AHN's resources for ADHD or sleep disorders, we will have more information on our website, kdka.com/talkpittsburgh.